With better knowledge, we make better decisions. No matter where you work, it's hard to disagree with that logic. It's even harder when your work impacts directly on the lives of other people and the stakes are high, as it is in health and care. Whether you're exploring options for a patient's treatment or you're commissioning a whole service, evidence-based decision-making must be best practice across our system. Remember the last time you built flat-pack furniture? Whether you contemplated it or went ahead ignoring the instructions, it is tempting to get straight on with the job at hand and rely on what you know from previous experience. Yes, you might succeed in actually building something, but if you stood staring at the screws, nuts and bolts that are left spare, how confident are you with the final results? For some, it can be a bitter pill to swallow, but relying on your own experience without exploring what else is out there is much like burying your head in the sand. Equally, working in such a busy environment as health, it can feel impossible or indulgent to take time for catching up and staying up to date. But by improving your skills in intelligence gathering, that is the activity of finding and filtering through evidence, you can reduce the time it takes overall and consider it well spent. Making the evidence come to you is one simple step you can take by using RSS feeds, social media, or signing up for alerts, notifications or newsletters. Linking with key organisations and leading journals in these ways are a simple first step. Something else to consider is whether the knowledge you need day to day at work is accessible quickly and easily. Think of internal records, notes and reports for example. Whether you're sat at a desk or you're on your feet every day, introducing some basic content management processes, that is, the activity of storing and organising knowledge and information in a consistent way, you can reduce the time it takes to find what you need. Breaking habits like saving files to your desktop or in your emails and making new ones like using version controls and storing to shared drives will save both you and your colleagues precious minutes which all add up. Not to mention lessening frustration and ticking the information governance box too. Thinking about your colleagues, how often have you found it to be true that two heads are better than one in solving a problem at work? When a challenge presents itself, you can wonder, why me? But the likelihood is that whatever you're faced with, someone else has had the same or a very similar experience before. Connecting with other professionals in your field, and sometimes beyond, can open up your eyes to a range of ideas, solutions and possibilities you might not otherwise have considered. You could also recognise the value of your own experience and knowledge as a first step. Others need and want it. Being proactive to share what you know with others, whether in a report, through a presentation or a network for example, gives them an incentive to share with you back in return. Look out for opportunities to spread your knowledge and to draw on that of others. This includes conferences and attending relevant meetings, but it can also be as quick as sending a tweet, an email, using an intranet or online messenger at work, or joining an online community or network. By now I hope you're getting a feel for what we mean by better knowledge. To act with better knowledge means to be efficient and skilled in capturing, learning from, using and sharing the evidence and knowledge around us, and sharing what you know so others can act with better knowledge too. It's about effective knowledge management. Learning and collaboration are the foundation to all of these activities. The most important question you can ask in order to learn something new and acquire better knowledge is why. Whether something has gone especially well or not at all well, by reflecting on what has happened and asking why, you can get better results next time around. Learning is key to improvement, and in the wise words of Don Berwick, in every failure are the seeds of your next success. Taking some simple steps to capture what you learn, share it with others and refer back to it so that it informs your work, gives every positive and negative outcome a true value for the future. So not only with better knowledge will we make better decisions. By making better decisions, we will deliver better care. What will you do to achieve better knowledge, better care?